Hey, it's Dr. Kyle with Project Wellness Company. We've talked about the different services within the office, but today what I want to do is I want to give you a quick glance as to some of the different things that we offer and how the many ways that we help our patients achieve their goals to be able to exercise again, to be able to run marathons, to be healthy, not only for the short term, but for the rest of their life. So to start, as we're coming through the office, the supplements that you carry in the office are medical grade, which means that they're as close as pharmaceuticals as you can get, and they're actually going to do what they're designed to do, which is super important when we're talking about lifestyle modifications. We're talking about getting the cholesterol numbers down and getting the body functioning on an internal environment and working. We utilize specific supplements based off of the blood work, based off of an individual patient's needs, and not just throwing caution to wind and saying take this because you should. And then as we continue to walk through, you're going to notice that we have a huge therapy area. The therapies we do in our office are specific to the patient, not only to what they have going on, but on a structural and a biomechanical process in order to get the curves back into their spine, to get their hips level, their spine straight. So depending on what a patient has coming in, we'll utilize different therapies according to their needs and how we're going to best suit them in order to restore function and mobility back into their spine. Now, we have 3 different adjusting rooms. There's 3 doctors within the office, okay? And so we have plenty of space as far as to adjust our patients, take care of our patients, and have that one-on-one need as we are treating them and getting them back to a healthy life. And another key component to what we do within the office is our functional mobility. So a lot of the testing we'll do when a new patient comes in is we're going to look and see how mobile they are, how much strength they have, how much flexibility they have. And based on those different parameters, we may have them work with one of our trainers to get those functional pieces back working in their body. If it's a lower back issue that the muscles aren't firing correctly and we have gait issues, we'll have our trainers work on that. Or if they just literally can't get up and down because they've lost strength, that's something specific that our trainer is going to be working it with them specifically. You'll notice that a lot of the things we don't have a lot of big equipment. And the truth is you don't need a lot of big equipment in order to be functionally fit, okay? As we continue back, another room here with specific training things in order to get mobility back into the spine, to get a curve back into the spine and get rid of some of the arthritic and degenerative changes that are occurring within the spine as somebody would be degenerating. On the right, we have multiple exam rooms. And then right here, we have our massage therapist for doing all of our massage therapy. We have 1 hour, an hour and a half time slots for them to come in and to work on the soft tissue component of their spine to get mobility back into those muscles, to get adhesions broken down, trigger points broken down, and actually allow those muscles to heal back to their proper state in conjunction with getting the spine functioning and moving and getting those curves back into it. So it's a key component to what we're doing within our office in order to restore spinal mobility. And last but not least, in the back, if we need to, we take X-rays. I always tell patients when we take X-rays, they don't lie. So we're going to know exactly what the structure of the spine looks like. We're going to be able to see if we've lost curves, if we have issues with discs, if there's stenosis, a narrowing of a canal, or narrowing where that nerve comes out. So super important for us to know exactly what the structure of the spine is, so that way we know exactly what kind of care we would recommend in order to get that problem gone, not only for just the short term, but for the long term, okay? Nobody wants to get rid of their problem and only have it come back in a month or 6 months, okay? They want to get rid of it for the long term. And so these are the different avenues that we use in order to restore the curves into the spine and get the spine back functioning. So if you want to learn more, give the office a call, check us out on the website. Phone number is 608-833-9445, or check us out on the web, allaboutchiropractic.com.